According to the National Institutes of Health, 80% of adults will experience lower back pain sometime during their lives. Though it can strike at any age, lower back pain is most common among older adults. We visited a chiropractic office to talk to the doctor and massage therapist about things that you can do to alleviate back pain.
Hello, thank you for joining us today at Silver Sage. I'm Joan, Rudder-Ward, your host. And today we're filming from Dr. Hannon's chiropractic office. And my guests today are Dr. Hannon and Ken Davis. Dr. Hannon has 33 years of practicing chiropractic, and Ken is a licensed massage therapist with a specialty of ortho massage. And we know as we get later on in that second half of life, we can have back problems and arthritis problems. So these gentlemen are here to tell you of some things that can help with that. So thank you for joining me today.
Thank you.
Thank you.
All right. Okay, so before we actually get into what you do and how you can help people, tell me, I want to know a little bit more about your extracurricular activities. I understand you guys are bike people, you like those motorcycles and things. So tell me about that. Dr. Hannon, I understand that you do some competition.
Yes, I've been competing for about 40 years, and it's in a type of event called English Trials. The thing with trials running, it's about skill, it's not about speed. And so like I say, I've been doing it for 40 years. There's no age classes locally. There are age classes in the national events. But locally I compete against the younger riders as well, and I still do pretty well. Last year I got third in the class for the season. I did have a couple of wins. And so it's a lot of fun, it's a lot of exercise, and you have to practice frequently to stay on top of it. It's about balance, it's about skill.
All right, that's very interesting. And I guess you have to keep your back in shape for...
I do get adjusted fairly regularly. My son competes as well, and we do treat each other usually after an event or after a practice. We'll check each other and make sure that everything's moving the way it should be. And it keeps us in good shape, and the exercise is good, and like I say, it's very enjoyable to do.
Yeah, okay, hey, that's pretty cool. Okay, now you, Mr. Bike Man there, are you racing or what are you?
Well, like Doc Hannon, I've been riding for about 45 years.
Wow.
But I'm a street rider. So most of my riding is just for leisure, vacations, and things like that.
Oh, okay, all right. So, but you're out there on the streets too. We have to watch out.
I'm on the road almost every day.
Almost every day. Okay, great. Now, I was doing some research, and it is estimated that probably 80% of all adults have some type of back pain. And with, as we get older, with us in the second half of life here, the research also says that, it's due to the degenerative condition of the spine, or the spine starts to degenerate after so long. So can you tell us, in your practice, what have you found as far as, back pain, lower back pain? What are some of the common reasons for it? Is it mostly an age-related thing, or what is it?
Well, probably, like you say, 80% of the population is going to go to the doctor at some point in their life for back pain. I always say the other 20% just refuse to go. And so we all will end up at some point in our life having some issues with our low back. quite frequently that is degenerative in nature. And certainly the elderly patient is more apt to have the arthritic changes and the degeneration of the discs as well. And so probably the majority of our patients start in their 40s or so and start to come in at that point. And then it's not just age related, it can also be the type of work or the type of activities the patient is doing. We see a lot of truck drivers, they're sitting there all day, they're bouncing up and down in the seat, they're not getting out moving around, and they're usually quite heavy as far as weight is concerned as well. And so those are one type of individual, and quite often they can be in their 40s and be having extreme difficulty with their back issues. And then we'll see elderly patients as well, 60s, 70s. We see patients, I've seen patients in their 90s, and certainly at that point in life they're going to have a lot of degenerative changes. The arthritis itself is not inherently painful unless it's irritated. And so when it becomes irritated, then we have inflammatory response, and that sends chemical messengers to the nervous system that cause irritation, and we interpret that as being a painful signal. And quite frequently, that's why when we take an anti-inflammatory, like an Advil or something of that, naproxen, Aleve, we get relief because we're reducing the inflammation in the area. A lot of our pain indicators come from swollen tissues, so there's stretch receptors in the tissues. We take that down a bit with an anti-inflammatory or through massage therapy. A cold pack has the same effect. It reduces the pain level. The arthritis is still there. It hasn't changed at all, but the inflammatory part of it has been diminished.
Oh, so that's how that works.
Yes, and even getting up and walking around can make a difference in your back. Quite often, patients indicate first thing in the morning they're severely stiff, they have a hard time getting out of bed, getting fully upright, but once they start moving, then they start to feel a little better. And what they're doing is they're pumping that fluid out of the area, and as that fluid is spread throughout the body, you have a diminish of the swelling and the stretching of the tissue, and you get some pain relief. People can get up and move around and at some point start to think, hey, I think it's gone away. As soon as they sit down, 20 minutes later, go to get back up, they'll be aware of it again.
In that particular instance, what are there some preventative things that people can do? Like if you, okay, you're talking about the arthritis part now. You said it's still there. What is it that people can do to, like at home, to alleviate that?
Well, using ice packs will alleviate it. Movement will alleviate it. And taking an over-the-counter anti-inflammatory can help. Now, we don't want to do that continuously.
Right.
That's not something that you want to do month in, month out. Brief periods are not too harmful for us. But there are natural anti-inflammatories as well. Fish oil is a natural anti-inflammatory. Boswellia, turmeric, those are anti-inflammatories. Those are quite effective as well, and you can buy those at say a vitamin shop, something of that type. They'll have anti-inflammatories out there. They're not going to have side effects that some of the medicinal type anti-inflammatories may have. And certainly there's different levels of medication that can be provided, up to steroids. And steroids are quite effective in reducing inflammation, but they're not really good for us.
Right.
And so we want to save those for when we're in severe pain.
Severe pain, okay.
Yeah, and quite often we will refer our patients to a medical doctor to get some pain relief, otherwise we're not going to get an opportunity to treat. And that's a very severe patient. Maybe a few times a year we'll have it at that level. Quite often, like with Ken here, we'll have Ken do a massage therapy first. That alleviates a lot of that inflammation and that swelling, and gets the patient to a point where we can do some manipulation and help them out with that as well.
Oh, okay, I see. Okay, so the way you guys work together then, so do they get massage first and then the chiropractic, or?
It depends on the case. It depends on the case and on the individual. If it's a traumatic incident, they may have traumatized their muscle tissue as well. And again, we might have that seen first by massage therapy and then move into the chiropractic care. We do other modalities as well, chiropractic, not just the manipulation. And so they can be brought in, shortwave diathermy, ultrasound, muscle stim, those types of things are used as well. The massage therapy quite often can make a huge difference in whether or not we're going to get an opportunity to treat.
Oh.
So it's very important. It works very well with chiropractic.
Okay, I see. So, Ken, do you have, what is the majority of the type of problems that you deal with?
Most of the problems are low back, sciatic problems, and the neck. It seems like a lot of people get problems with the neck, low back, and sciatic. Part of that is the way that people have to travel today, going to and from work in their automobile all day, pushing down with that right foot and being tense and tight anyhow. And this will cause a sciatic problem. So with the massage, what you try to do is help to reduce the swelling, tension, and pressure that's going on with the muscle and the way that the muscle is acting on nerves.
All right. We're going to take a break right now, and we'll be right back. Thank you for rejoining us. I'm here today talking with Dr. Hannon, chiropractor, and Ken Davis, massage therapist, who are here to help you with your back, your aches and pains. Okay, now Ken, you were mentioning about people being in their cars and tensing up and driving long distances and things. Now I never. Well, I'm not going to say never, but I really didn't associate that much with why we have so many people with, back problems. But stress and just the way we live today contributes to that. So what do you see as far as with people who are having stress?
Well, in the world we live in today, there's a great deal of stress. The news is coming at us 24 hours a day. Every time there's any little thing going on, people get stirred up about it. And this is stress.
Especially in the election cycle. But anyway, go
ahead. This really creates a lot of stress and tension. I had an experience recently. I was on a vacation, which I do on occasion. And I was driving down towards Palm Springs. And as I was driving along, I think I'm usually staying stress-free and relaxed and comfortable. And I was driving along in the traffic, and it dawned on me that I was holding myself very stiff at the wheel and with a lot of tension. And I went, Ken, you know better than this. So I thought about it, and I just calmed myself down, slowed down, backed out of the traffic, and just drove along. That stress and tension is difficult on our body, and it just continues to magnify if we don't take control of it. How can we take control of stress? Oh my, there are many ways. One, we can take a nice casual walk. We can go to our massage therapist. We can go to our chiropractor and get stress removed from our lives. Those things will help us to calm down, settle down, and be more stress-free.
Okay. All right. So yeah, we just live in a society of stress.
Seems that way.
The world is stressful. Like you said, I didn't think about hearing the news 24 hours a day.
Oh my goodness.
We have that. Not that we listen to it, but the ability to do that is here. To be plugged in.
Right.
Speaking of which, like with the electronic age that we're in now, do you see just like even having that? People having that accessibility to you 24 hours, just that ability to be wired up, I guess, be connected.
I think that that being wired up and being connected is also a problem and creates part of the stress. I like to go and have a casual cup of coffee, just sit and talk with people and have a good time, enjoy the time together. But when I go to the restaurant, more often than not today, I'll be sitting there by myself, just sitting drinking a cup of coffee and looking around at the numerous people that are either playing their game or doing whatever it is they're doing on their connection. And if you evaluate and you look at the people, you can actually see the stress at a table between the people because they're connected to their own little device, but there's tension that grows between the people. It amazes me. I don't understand it totally. Do you? What do you think of it?
Well, I've been practicing, over 30 years. When I first started, we were getting into the computer being used quite a bit, and so I kind of saw it somewhat from the beginning. And I have had a bit of a work comp background as well, and the work comp system thought, once we get everybody using computers and not doing the manual labor as much, we're going to see a lot of decrease in the work comp costs. That didn't occur. What happened is it went more from low back to neck upper back, because they're sitting there for extended periods of time on the computer. They're very focused on what they're doing. They're not focused on their own person. And so at the end of maybe a 2 or 3 hour session, which they thought was 15 minutes, they've got one shoulder up around their ear, and they're reaching over and trying to push it back down. They didn't realize they were that way for an extended period of time. And so it's the same when we're in the automobile or in the driving in heavy traffic. We tend to focus so much on the traffic. You have to. Otherwise, you're bouncing off everybody because it is so tight and at such high speeds that when people are commuting from like the high desert, it's not unusual for them to be doing 80 miles an hour with somebody 4 feet off their front and 4 feet off the back and one on each side and a big rig there. And
right.
The amount of focus and tension there is very high. And so these people may be commuting for up to an hour. They're spending 8 hours on the computer and 4 hours in traffic. By the time they get home, they're pretty uptight. And it's very hard to unwind. And so people come home and they don't want to do anything for an hour because they need to unwind a bit. And yet they get home, they got children to deal with as far as keeping up on the homework. They got meals to prepare. It's pretty sad. And to kind of help that along, we're starting to go more towards fast foods, and that's putting the stress on the population as well. We're all getting a little bit heavier. That's stressful on our frame, on our structure, and I don't see that diminishing any. The types of foods we're eating are inflammatory to our body, so that aggravates the complaint as well. We're taking in a lot more sugars than we did. When I graduated from school, I think we were taking in about 60 pounds of sugar a year. Now we're up to about 80 pounds of sugar a year. A lot of that sugar is in the form of fructose as well, and that was what was going on with the sodas. And we've tried to encourage people to back off on the sodas. They're very high fructose. There's a lot of caffeine in it. What do we need when we're stressed? More caffeine and sugar? No, we need to settle down. And so a lot of our changes in society have aggravated these issues. And I don't see that changing to the better in the near future.
My goodness. Okay, so then when my husband comes home from work and he says, I just need to chill a little bit, then I just need to pay attention.
Tell him the truth, yeah.
Because he needs to come back down from that little bit of adrenaline because he's been in the flight or fight mode all the time he was traveling. So you need to settle down. You need to bring that adrenaline back down or you're ready to fight or fly.
Yeah.
Oh, okay.
So
all right.
Don't say anything
all right,
about anything important. Keep it casual at first.
Yeah, okay. Well, I'm going to remember that. You might have already said it before, but just give some tips for people to, okay, we know we need to chill out when we come home and come out of that traffic. Are there some other things, or you can reiterate, that we need to be aware of, because just like when you were talking about, you're sitting at the computer, you don't even realize you're like this. I mean, I found myself like that before. You know, it's like, oh, well, wait a minute, relax, stretch. You know, it's probably good for people to maybe every hour or so get up and take a break or stretch or something.
Yeah, we are seeing some things being done. One of them is a desk that elevates so you can stand up for a while and sit down. That's a very good idea. And that gives you an opportunity to move around, use some different muscles instead of using the same muscles all the time. I would say nutrition-wise, we need to start looking at our nutrition, start reading the labels, and finding out what we are taking in, because we're overdosing our body with all kinds of chemicals and things that are just too much. My son, he's a chiropractor, Dr. Clive Hannon, and his wife is a health coach, a certified health coach, and he is as well. And they do a lot of nutritional counseling, and they do a lot of detoxing. And people that don't realize that they've been taking in all these things over the years, and it's accumulated. And so getting a good detox done, you feel refreshed as a result of that. And it helps get that out of your system. It helps your liver, it helps your kidneys, it helps blood supply. And he was talking about the thing with the adrenals. We're in that fight or flight mode most of the time in today's society. And it's very hard on the body. It has to do a lot with a variety of things as far as your hormones are concerned. And so it's all interconnected. And when we constantly stress it, we end up paying a price for it in the long run. And that could be a variety of health issues. And so part of the thing with chiropractic is being an alternative type care is we're not trying to deal with a particular symptom. We're trying to increase the overall health. And so it's not just structure, it's nutrition, and it's counseling about stress. It's counseling about weight, trying to do something with that. We have a interesting case where a patient's had 3 back surgeries, still in severe pain, and was quite overweight. Now, he didn't start out that way, but he got that way. He had been a truck driver originally. The surgeries kind of slowed down activity. He didn't really follow through as well as he should have with physical therapy afterwards. And he gained a lot of weight. He was having a lot of trouble. I happened to see him one day, and I talked to him a little bit, and I told him, you know, you drop some of that weight, you may find that your back feels a lot better. So he came in, he did the detox, liver detox. He got a program of weight reduction going. A lot of times the liver detox thing teaches you how to eat. It teaches you how to read the labels. It teaches you how to cook and how to make things that are good tasting, but are healthy for you as well. And that's part of that health coaching that they do. Anyways, he lost about 40, 50 pounds. He told me the other day he went down to the beach, got in the ocean, and was swimming. Well, to him, that's a really big deal. And he's looking better. He doesn't have the back pain like he had in the past. This goes on with other things as well, like knees, hips. Getting yourself in good shape can reduce those issues as well. And so, you know, having the massage therapist is important, but also having general health coaching is important as well.
Or what do you tell your patients, like when they come in? Where do you give them to help themselves at home?
Well, every case is so much different. If a person is in an overweight condition, I continue to badger them, some say, to try to coax them to change their eating style. And by changing eating style, what do I mean? Do I mean to just go from one restaurant to a different restaurant? No, not necessarily. What I actually suggest is that they begin to eat more food. And by food, I mean things that don't have labels on them. You don't have to read the label of a tomato or an apple or a banana. You know they're food. So that's the direction I take with helping them to lose weight. As far as mobility, one of the things along with the massage and chiropractic care for mobility is to take a casual walk. Just walk around the block. I'm not talking about walking around the block at 5 miles an hour so that you're covering the distance in the time that you've got allotted. I'm talking casual. Smell the roses. Look at the birds. Enjoy the scenery. So part of what I like to do is take a natural approach to bringing the person back down to life, back down to earth. Get them back out of those clouds a little bit and say, okay, you know, you really can live a different life if you choose to.
Okay. I want to thank you gentlemen for joining me today.
Thank you.
And you can find out more about Dr. Hannon and Ken Davis and their services on our website. Have all their contact information there. So we want to thank you for joining us today, and we'll see you next time.